Hi everyone, hope you're doing well and happy Women Wednesday. Today we're going to discuss PEP or post-exposure prophylaxis for HIV prevention for women. Just gonna wait for Whitman-Walker to join us and then we'll get started, but hope everyone's doing really well. Awesome, and there's Whitman-Walker. Thank you for joining. Cool. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, sexual health prevention, sexual health practices, access to care, social determinants of health, and public health interventions. The Whitman-Walker Community Health Team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Team. And again, today we're going to discuss PEP or PEP for women. So if you are HIV negative and think you've been exposed to HIV, you can ask for PEP or PEP. PEP, also known as post-exposure prophylaxis, is a 28-day course of medication that can prevent HIV after possible exposure. PEP is most effective when started within 72 hours of an HIV exposure and for emergency use, and is available at Whitman-Walker as well as your local emergency room or local ER. To access PEP of Whitman-Walker, you can call our PEP line at 202-797-4439 for support through our Logan Circle or Anacostia Health Centers. Again, PEP is also available at your local ER, so you can also access it that way. One way to think about PEP is kind of the equivalent of Plan B, but instead of Plan B for birth control or pregnancy prevention, and that has to also be taken within 72 hours, you take PEP within 72 hours to prevent HIV. So whether exposed to HIV through consensual or non-consensual sex or sharing needles and works, it's important to seek PEP within 72 hours of an exposure to HIV for it to be effective at preventing HIV. PEP may be a good post-exposure HIV prevention tool for you if you have experienced sexual assault, if you're sexually active and didn't use external or insertive condoms and are unaware of your partner's HIV status, or if you identify as someone who injects drugs and shares equipment, or are having sex with partners who inject drugs. DC residents can access PEP by visiting www.sexualbeing.org, and Maryland residents can access PEP by visiting www.marylandhealthconnection.gov. Finally, Virginia residents can access PEP or PEP by visiting www.vdh.virginia.gov. Women and people who are assigned female at birth are more likely to get HIV during vaginal or front hole sex because the vagina or front hole has a larger area that can be exposed to HIV-infected bodily fluids like semen. Also, semen can stay in the vagina or front hole for several days after sex, which means a longer exposure time for women and people who are assigned female at birth. And having untreated sexually transmitted infections or STIs makes it more likely that a person will get HIV if they were exposed to it. So it's just super important to stay on top of your testing and get tested regularly if you are sexually active. Getting tested for HIV and STIs is the first step in anyone's HIV prevention journey. Depending on a person's sexual health practices and activity, getting tested every 3 to 6 months can go a long way in preventing STIs and HIV. Untreated STIs make it easier to become positive after exposure to HIV, so it's really important to get tested often and regularly and make it part of your healthcare routine. Now, according to womenshealth.gov, most private insurance plans must cover HIV testing at no cost to you. Medicare and Medicaid often cover HIV testing, but you might have a copay or coinsurance or deductible. So call your insurance plan to learn more about what coverage they offer for you in terms of HIV prevention and sexual health. You can also learn about Whitman-Walker Health's testing hours and locations at whitman-walker.org/testing. HIV and STI testing are available by appointment at Whitman-Walker's locations, and you can call us at 202-797-4439 to schedule a testing appointment, but also be sure to check the website for the most up-to-date hours. Whitman-Walker's locations are as follows. The Max Robinson Center is located at 2301 Martin Luther King Jr. Avenue Southeast in Anacostia. And Whitman-Walker Health is located at 1525 14th Street Northwest near Logan Circle. If you receive a positive HIV test result or are living with HIV, you can start treatment for HIV. Talk with your medical provider about your treatment options. When a person is living with HIV, they can manage their HIV by taking their HIV treatment as prescribed. This means taking it as your doctor directs you to. So if they say, like, take this in the morning and the night, you take it in the morning and the night. If they say take this once a day, you take it once a day. By being on treatment, you can decrease the risk of passing HIV onto someone else. This is also known as treatment as prevention. So people who are living with HIV who take their treatment as prescribed can achieve an undetectable viral load. An undetectable viral load means that there's effectively no risk of a person transmitting HIV sexually to another person. This is also known as U equals U, or undetectable equals untransmittable. Missing treatment puts a person at risk of regaining a detectable viral load. So it's really important to take your HIV treatment as directed and as prescribed and as your doctor instructs you to. To start treatment, you can call Whitman-Walker at 202-797-4437. Again, that number is 202-797-4437. And you can just say red carpet on the phone line to our team member. They will support you in getting an appointment at either Whitman-Walker's Logan Circle or Anacostia Health Centers. You can also call us at 202-745-7000 or email us at appointments@whitman-walker.org to schedule an appointment. Just mention red carpet and our team can help a person start treatment for HIV. If your community or organization is interested in the Whitman-Walker team providing mobile health services in your neighborhood, you can contact us at mobilehealth@whitman-walker.org. Again, that's mobilehealth@whitman-walker.org. And you can also access PEP, or start HIV treatment for HIV with Whitman-Walker Health at our Max Robinson Center, again in Anacostia, or our Whitman-Walker Health Center near Logan Circle. Thank you for taking a little bit of time to learn more about PEP for women and people who are assigned female at birth. But of course, before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step toward preventing yourself and your loved ones and your communities from getting sick. Multiple variants of COVID have soared across the world, and it's totally understandable if you want to continue to wear your mask in tight spaces or really crowded spaces or spaces where there's not a lot of ventilation. As we all know, that the vaccine isn't 100% effective at preventing new cases of COVID-19, but it is very effective at keeping people out of the hospital with COVID-19, keeping people from getting really sick with COVID, and also keeping people from dying from COVID-related complications. That said, if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available, and you can reach out to us at 202-207-2480 to schedule an appointment. Again, that's 202-207-2480 to schedule an appointment. And if you're having trouble making an appointment with us, DC residents can find more information about COVID-19 vaccine locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can learn more about the vaccine distribution process there by visiting vaccinate.virginia.gov or by calling 1-877-829-4682. If you have not been vaccinated and are not looking for an appointment to get vaccinated for COVID-19, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting vaccinated and discuss COVID precautionary measures with those who are around you. And be mindful of masks and keep your distance, but especially when you do not know whether a person has been vaccinated or not. Now, since we're battling more than one public health pandemic, we also want to share some information about monkeypox. So according to the CDC, there are more than 18,417 cases of monkeypox documented in the U.S. In D.C., you can pre-register for a monkeypox vaccine appointment. And Virginia is currently working with local care providers to contact, trace, and identify those most in need of the monkeypox vaccine. And varying counties in Maryland are allowing residents to pre-register for monkeypox vaccination. But overall, please visit your local state health department for more information on how to register and get vaccinated against monkeypox and see what their process is for monkeypox vaccine. We're still under-resourced in terms of the amount of vaccines available compared to the people who are in need of them. So just keep tabs on your local health department, follow their Twitter pages, check out their websites in the mornings and see what they're saying. In DC, as of Friday, August 5th, walk-up vaccinations are now available from noon to 8 p.m. on Fridays or while supplies last at DC Health monkeypox vaccination locations. They're currently located at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street Northwest in Ward 2. Walk-up vaccinations will be provided on a first-come, first-served basis to eligible residents who have not already received a first dose of the monkeypox vaccine. And again, you can pre-register for an appointment. For vaccine in DC, just visit the dchealth.gov website to figure out where you can pre-register. You're currently eligible to be vaccinated in DC if you are a District of Columbia resident who is 18 years of age or older, and if any person of any sexual orientation or gender who has had multiple sexual partners in the last 2 weeks, including those currently considered highest risk, which would include gay, bisexual, and other men who have sex with men, transgender men and transgender women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. You will need to provide proof of residency in order to be vaccinated, so you're able to show an ID card with a DC address, a utility bill or other piece of mail with your name, and a DC address or a current DC lease or mortgage with your name on it. That's all we have for you today. Please follow our Whitman-Walker family on Facebook, Twitter, and Instagram at Whitman-Walker. You can also visit our website at whitman-walker.org to keep up with the latest information on our services, and follow our Walker family at RealTalkDC_ and at NoFilterDC. Thank you all so much. I'm wishing you an amazing rest of your day and an amazing rest of your week. Have a good rest of your night.